Sinonasal polyposis refers to the presence of multiple benign polyps in the nasal cavity and paranasal sinuses. It is most commonly encountered in adults and rare in children. Polyps are the most common expansile lesions of the nasal cavity. Polyps are formed by the influx of fluid into the lamina propria of the sinonasal schneiderian mucosa. Classification. The Meltzer grading system is a clinical grading system that is as follows: refer. Grade 0. No visible polyposis. Grade 1. Single polyp confined to the middle meatus. Grade 2. Multiple polyps in the middle meatus. Grade 3. Extending beyond the middle meatus. Grade 4. Nasal cavity obstruction. CT features are demonstrated. Extensive mucosal polyps occupying and obliterating the nasal cavity and the paranasal sinuses. Usually, they are hypodense but may be hyperdense due to increased protein content or fungal infection. Sinonasal polyps associated local benign bone remodeling or erosion, enlargement of infundibula, attenuation of the ethmoid sinus walls and nasal septum, occasionally sparing the inferior nasal meatus, truncation of middle turbinate, opacified ethmoid sinuses with convex lateral walls and gas fluid levels. And a concurrent fungal sinus infection may be present. Complications are including osseous metaplasia and aspirin-exacerbated respiratory disease. Differential diagnosis. 1. Sinonasal retention cyst. It can be indistinguishable and usually spares the nasal cavity. 2. Allergic fungal sinusitis. It commonly associated with polyps, hyperdense central areas, and MRI may show low T1 and T2 signal. 3. Granulomatosis with polyangiitis. It's centered in the nasal cavity.